Welcome to KATV India. I am Tejas Khatukar. Imagine turning your tap on and the water that's supposed to keep you alive ends up killing you. That's exactly what happened in Indore, where contaminated drinking water has now been linked to 7 deaths and dozens of hospitalizations. Here is what happened. Multiple residents from affected areas of Indore were rushed to hospitals after developing acute gastrointestinal symptoms, which include severe vomiting, diarrhea, dehydration, and fever. Doctors treating the patients told authorities that the symptoms were consistent with waterborne infections, commonly caused by drinking contaminated water. Despite medical intervention, 7 people could not be saved. The question here would be that how did this happen? Health officials and civic authorities suspect sewage contamination in the city's water supply. And here is how this usually happens. Either old or damaged pipelines and leakage near sewage lines, or negative pressure pulling sewage into drinking water. Residents had reportedly complained about foul smell and unusual color in tap water days before situation escalated. After the deaths were reported, the Indore Municipal Corporation took emergency steps, where water supply from suspected lines were immediately stopped. Water samples were collected for laboratory testing and alternative water tankers were deployed. A formal inquiry was ordered to identify lapses, and health departments have issued advisories asking residents to boil drinking water, avoid untreated tap water, and seek medical help immediately if symptoms appear. And here's the bigger issue. This isn't just an Indore problem. Health experts repeatedly warn that waterborne diseases spike during pipeline leaks and poor maintenance, even in major cities. The World Health Organization has long stated that unsafe drinking water is a leading cause of preventable deaths, especially in urban areas with aging infrastructure. So, the real question is that why do we still react only after people die? Why does the government take action only after deaths? Clean drinking water is not optional. It's not a privilege. It's a basic public health necessity. And when systems fail, the cost is measured in human lives. Authorities say that investigations are ongoing and responsibility will be fixed once lab reports are confirmed. Until then, the families of the affected continue to grieve, and the rest of the country should pay attention, because the next contaminated tap could be anywhere. I am Tejas Khatukar and this is KATV India. Subscribe and stay tuned for more.